Welcome to this first pre-lab video. This video will cover the necessary knowledge so that you can walk into the first lab with the necessary information. Today we'll be covering anatomical directions and an introduction to the microscope as well. Now, to get started, anatomic terminology or anatomical terminology is based largely upon anatomic position. Anatomic position is simply a standard. It's a way by which all medical professionals and anatomists deal with describing one structure in relationship to another structure. And here is an example of anatomic position. What you see is that the individual is standing up. Their feet are parallel and flat on the floor. The head is looking forward, eyes looking forward, and their arms are down to their side with the palms facing forward and the thumbs pointing away from the body. So when you describe how the liver is in relationship to the heart, you would imagine that the person is standing in front of you like this. Even if a person is laying in a hospital bed or has had some sort of trauma, you would still use this standard position as a way of navigating and discussing how one structure is related to another structure. Imagine the confusion if there wasn't a standard anatomic position. Now, when you're describing structures, oftentimes one will be looking at the body and using directional terms to describe how one organ or structure is in relationship to another. Now, there are a number of these terms, and as you'll see here, they all have opposite or correlative terms. So let's take a look at these. Now, some of these terms are a little bit more familiar to you than others. The first pair of terms are anterior and posterior. Now, I recognize that these are not words that are typically spoken in everyday language, but they are words that you will hear a lot of in this course and that you need to become familiar with so that when these words come up, you have an immediate understanding of what it means. It takes practice, and we'll talk about that, and we'll get a chance to practice during the lab this week. So there's two sets of words here that mean largely the same thing. Anterior and posterior are one set or one pair of these words. Anterior means to the front of, and posterior in the back of. Again, you imagine that your person is standing in anatomic position. Now, the other set of words are ventral and dorsal, and they mean slightly different things, but yet are used interchangeably. Ventral means toward the belly side of the body, and dorsal means toward the back side. Think a dorsal fin on a shark, right? It's on the back side. When you're using these terms, you want to keep the pairs intact. So in other words, if you're saying that something is anterior, you would want to use posterior as its opposing opposite term. You would not want to mix and match the terms in the same sentence or conversation. Another term, now this term is not included in your green lab manual this semester, so this one's a little extra. But here are two terms that you're going to see and hear a lot about in a hospital or in a home health setting, and that is supine and prone. Now, in this situation, and only in this situation in the examples given, the person is not in, quote, anatomic position. Clearly, this person is not standing with their feet on the ground. So that's why this set of terms, supine and prone, are typically not included in this conversation, but they're so commonly used, I want you to make sure you know them. So supine simply means that the person is lying with their face up, right? They're laying on their back and they're facing up, and prone means that they're facing down. They're on their belly side down. So this would be true on the ground or in a bed, right, or on the floor. Another pair of terms, now a couple of these are a little bit more familiar. First of all, superior and inferior. These are not completely foreign terms to us. Superior, toward the head or above, and inferior, down below, toward the feet or not toward the head. And we know this term, right? Lake Superior. Lake Superior is the top Great Lake, right? It is the most northern. It's the one toward the top, if you will. Now, caudal and cranial, you will see these terms used, not as commonly. Caudal at the rear or the tail end, cranial toward the head end. So we'll discuss the cranium later in the course. That simply deals with the bony structures of the skull, where the brain is included. So cranial is a word you'll hear more often than caudal. However, when we get to our fetal pigs and we're describing the anatomical relationship of structures in the fetal pig, keep in mind that the anatomic position for a four-legged animal is different than yours and mine, right? For a veterinarian describing an animal, the animals, let's think about a dog. The dog's anatomic position is sitting on, is standing on all four legs, right? And their head is forward and their tail is in the back wagging. So in that situation, caudal means toward their tail, right? Cranial would mean toward their head. Thinking back a moment, dorsal would be toward the sky, right? Off their back. And ventral would be at their belly toward the ground. So when we do our fetal pig dissections, we'll remind you of these terms again. And at the very beginning of the fetal pig dissections in Lab 7, you will hear these terms again and be reminded of how things are just a little bit different when we're thinking about a four-legged animal. Other very important terms include medial and lateral. Medial, toward the midline. Again, we're back into standing anatomic position. But medial, toward the middle. Lateral, toward the outside, right? Toward the outside. Deep and superficial. If you watch some CSI sort of shows, you'll hear about deep gunshot wounds and superficial wounds. This one's pretty intuitive. Deep means deeper underneath other structures, away from the surface. Superficial, toward the outside or toward the surface. And then ipsilateral and contralateral, we'll use these words a lot when we're discussing reflexes and brain injuries when we get to the nervous system. Ipsilateral means on the same side of the body, and contralateral on the opposite side. You may know that if a person has brain damage to their left hemisphere, to the left side of the brain, that the damage is often most visible on the right side of the body. It's on the opposite side, so we would say that's a contralateral relationship. And then the last two. And these two, to be honest, are the two that give students the most trouble as we get started in this conversation. Proximal and distal. Proximal and distal are only going to be used to describe terms on your appendages. That is, we're only dealing with structures on the arms and legs, okay? These terms would not be used to describe anything on the head, chest, or abdominal region. So we're not going to use these terms to describe head, neck, and abdominal or thoracic structures, but we'll use them to describe arms and legs, or that is your appendicular skeleton or your appendages. So proximal means toward the point of attachment. So we see right here that, for example, the shoulder would be the arm is attached to the shoulder, and so that's more proximal. And distal means greater distance away. So let's talk about these terms for a second. Let's think about your elbow and your wrist. Elbow and wrist. So the elbow, right, being closer to the point where the arm attaches, the elbow would be more proximal and the wrist would be more distal. Let's think about the knee and the ankle for a second. The ankle would be more, the ankle would be more distal and the knee would be more proximal. Okay, so we have some terms now to use. Another important way of discussing the body is to break it up into two very large sections, the axial region and the appendicular region. So the axial region, as you can see here, is the center, the axis of the body, and it's referring to the head, neck, trunk, abdominal regions. So that would be the center, right, the axial region. And then the appendicular region would be the limbs, that is, the arms and legs. When we get to the skeletal system, you will see that the skeletal system is oftentimes broken up into axial regions and appendicular regions. That is, we will learn the bones of the neck and head and trunk in a slightly different order than the bones of the arms and legs in the appendicular region. There are terms for all sorts of regions in your body. Here are some examples seen on an anterior view. Remember, that means toward the front, a front view. And this is the list of terms you need to learn. Okay, you're going to find in the lab folder a list of terms. These are called regional terms regional terms. And you'll find a list of these that you need to know for the semester, and this is a good representation of those. Some of these are very familiar to you. If I said to you, Simon says, touch your abdominal region, most of us would have no trouble pointing to our abdominal region. However, if I said to you, point to your mental region, you may not be as familiar with that one, and the mental region is actually the chin, right? It is not your head or your brain like many students think. If I ask you to point to your femoral region, you might know that that's your thigh. But if I ask you to point to your crural region, you may not be as familiar with that term. That is your front of your leg, the anterior leg. So the point is this: you need to go through and look at these terms. You will be familiar with what I'm going to call the kindergarten terms, right? You know shoulder and armpit and arm and elbow, but you may not be familiar with the anatomical equivalent term. So you do need to learn those. I have a picture here of both an anterior view, and there's also the posterior view. Okay, so take a look at these terms and learn those terms. Okay, so we've been dealing with what's on the outside of the body. Let's talk about what is on the inside. We're all familiar that we have internal organs. We have the brain, we have the heart, lungs, liver, stomach, etc. And those organs are all found in body cavities within the body. So first off, let's discuss the cranial cavity. The cranial cavity is the home of the brain, and the brain is continuous with the spinal cord, which is found in the vertebral canal. Now, when you look at the cranial cavity and the vertebral canal from the side of the body, this is called a mid-sagittal view. Do you agree that the cranial cavity and the vertebral canal are toward the back of the body, right? They are in the back. So we would say that these are dorsal body cavities, right? These are dorsal, they're toward the back. Or you could say they're posterior body cavities. Toward the front, anterior or ventral, we have the thoracic cavity and the abdominal cavity and the pelvic cavity. Now, the thoracic cavity is the home of the lungs and the heart. We'll come back to that. There is a muscle here. Let me change colors. There's a muscle called the diaphragm that is going to separate the thoracic cavity from the abdominal cavity. In the abdominal cavity is where one finds the liver and the stomach, some of the small intestines. And then even inferior to that, right, inferior below to the abdominal cavity would be the pelvic cavity. Now, what makes this awkward or perhaps a little bit confusing is that there's no muscle separator between the abdominal cavity and the pelvic cavity. And so many books will describe this all together. This is the abdominal pelvic cavity. That's one word, abdominal pelvic, that describes the continuation of the abdominal cavity down into the pelvic cavity. Now, your internal organs are not just sloshing around inside those cavities. They themselves are protected and separated from each other through some other membranes. Now, in anatomy, a membrane is a layer. It's something that separates We'll talk about this next week, but a membrane is an epithelial layer that separates one structure from another structure. And for your major organs, there are three of these serous membranes. Each of these serous membranes is composed of two thin layers. One is the parietal layer. Now, the parietal layer, if we look at the definition of this, a parietal layer is the one that lines the internal side of a body wall. We're going to see this word parietal used in many, many different ways this semester. But here, just know that this is the layer that is lining the inside of the body wall. And then the visceral layer is what is covering the outside of the organ itself. Okay, we'll see some pictures of this. This will make more sense in a moment. Another term you may be familiar with is viscera. Viscera is a term that means all of your internal organs. If you have a visceral response, it means you have sort of a gut reaction. So the visceral layer sits on the viscera, actually sits on, or as you hear me say, it is shrink wrapped to the surface of the heart, or shrink wrapped to the surface of the lungs, or of the intestines. Now, in between these two very thin layers, the parietal layer and the visceral layer, there is a space, a cavity, right? A cavity is a space. If you have a cavity, even in your tooth, right, it means that there's a space that's been created by decay. So a cavity is a space, and this little space in between these two layers is filled with fluid referred to as serous fluid. Okay? And it's a watery sort of fluid. And another thing that you need to understand is that these serous membranes do not open to the outside world. They do not have any access to outside of the body. It is not possible for you to touch or reach any of your serous membranes. They can only be accessed through surgical, moving into the body through surgery, breaking through layers of the body. Now, this serous membrane is there to allow organs to roll over each other, right? To move. It allows your heart to beat 50, 60, 70, 80, 90 times a minute without causing a lot of friction and buildup of heat. It also allows your intestines to move around as you're exercising or running around, right? Your organs are able to slide over each other because of these serous membranes that separate the organs one from another. So let's take a look at the body from an anterior view, looking at the front. But notice that the front layers of the skin have been removed, so we're looking into the body, and I'll describe this term in a moment, but this is a frontal or a coronal view of the abdominal, pelvic, and thoracic areas. And what you're seeing here, what I want you to see in this slide is this term, mediastinum. Now, the mediastinum is referring to an area here, and this picture has it labeled mediastinum. But if you look at it carefully, it's pointing to a bracket that goes from here to here. So basically, the mediastinum, if there were a bone right there, that big rectangle would be the sternum, right? The sternum. And the mediastinum is basically the area behind the sternum, okay, in the middle, right? In the middle of the body. So it's basically the space between the two lungs, and it's the space where one finds the heart. Right? This is a pretty important area, right? The mediastinum includes the heart, an organ called the thymus, the esophagus, and the trachea, and also the major blood vessels that are found going to and from the heart. And so that mediastinum is a very, very important place. You can see here that there's green areas representing where the lungs would go, blue for where the heart would be, and then we have the abdominal pelvic area here. So let's introduce those three serous membranes. There are three of them, and they all start with the letter P. That could be confusing, or at least you know that it's always going to start with the letter P. The first serous membrane is the membrane that goes around the heart. This is all this does. It goes around the heart. 2 layers. There is, as I've described, there is the parietal layer and the visceral layer. Remember, the visceral layer is the layer that is shrink wrapped onto the surface of the heart. Okay? So the visceral layer is touching the heart, lining the heart, whereas the parietal layer is lining the inside of this sac, right, that's going around. And in between, it shows there's a space there. That space is where that fluid is. Now, the pericardium that goes around the heart is found in the thoracic cavity. There is another serous membrane found in the thoracic cavity, and that's the one that goes around the lungs, and that's called the pleura. The pleura. And you may have heard of pleurisy. Pleurisy would be an inflammation, a buildup of fluid in that pleural membrane space. So again, the outer layer, the one that is lining the inside of your thoracic cavity, would be the parietal pleura. There are 3 major anatomical planes that we'll be using and discussing a lot this semester: coronal, transverse, and sagittal. And let me just point out the spelling on sagittal. It's 1 G and 2 T's. That is one of the most misspelled words of the semester. Let me describe each of those planes for you. So here's our friend standing in anatomic position. And the coronal plane is the one that is sort of the blue color in the image. The coronal plane is also known as the frontal plane. I always imagine that the front of my face is being sliced off as I think about this term. And just understand that there's an infinite number of these slices. So it does not have to be even slices of the body, but it would be any slice of the body in which the front is separated from the back section, or the dorsal section is separated from the ventral, or the anterior is separated from the posterior section. The transverse plane, shown here as the pink plane, now here we see it going across the waist area, but that transverse plane could be going across the neck, the cervical region. It could be going across the knees, for example. It is simply going to produce upper and lower, or superior and inferior sections. Now, this particular plane has 3 terms that are commonly used: transverse, cross section. It is the same thing, and you'll sometimes also see horizontal plane. So all 3 of those terms mean the same thing, and you need to know all 3. And then finally, here's that sagittal section. So the sagittal section is, in this picture, the one that's sort of a yellow section that is slicing the body into right and left sections. Now again, it doesn't have to be even sections. In fact, if the line goes directly through the perfect middle of the body and divides the body into perfect left and right sections, there's a special term for that, and that is mid-sagittal. So mid-sagittal is when you are down the theoretical perfect middle of the specimen. And the other left or right sections you'll sometimes see called parasagittal. But to be honest, typically you'll just see sagittal. But parasagittal you might see occasionally. One more thing is that sometimes you'll see the term oblique. An oblique plane is one at an angle. It isn't directly from the front, from the side, or from the top, as we've been looking at, but is from an angle, and that's an oblique angle. Okay, so we've been through the sections, we've been through the body regions, we've been through the membranes, the serous membranes, and we've talked about anatomic position. The last thing that you'll be doing today is examining the parts of the microscope. Here is a traditional microscope. This is a monocular scope, meaning it has one eyepiece. The scopes we'll be using in the lab are binocular. They have 2 eyepieces. And what you'll be charged to do is to learn the parts of the microscope. Depending upon the semester, you will be using the microscope nearly every semester. And if you are doing an online lab, while you won't be directly using the microscope, you will be using the microscope to look at a large number of tissues under the microscope. So you'll be seeing a lot of histological slides during the semester. So please learn the parts of the microscope, understand what they're used for. You'll find that in the exercise 3 of your lab manual, and your pre-lab will direct you to the proper pages. The microscope that we have at MCC looks more like this model, or is this model, and on Blackboard, under Lab 1, you're going to find an exercise that you can pull up to label the parts of the microscope, and you'll find that there's a key associated with that handout. So that is everything for today's lab. I hope that you have enjoyed listening to this and sort of getting your head wrapped around what's going to be happening in Lab 1. Make sure you finish your pre-lab activities and upload that before the lab begins. See you all soon.